Hello and welcome back, everyone. I think we're going to get started with our next session, which is about the pandemic. So the impact of the COVID-19 pandemic, what it's had on American life has been absolutely unprecedented, at least within this modern era that we're in. And it will likely take decades for us to fully grasp how the pandemic has changed us as individuals and as a society. What we do know is that in many cases, the pandemic laid bare existing issues while also creating new challenges in the way that we work, educate our children, provide health care, feed people, provide shelter, and carry out many of the other functions essential to daily life in America. Many of these challenges persist even as we work to emerge from this pandemic. As is often the case, however, with disruptive events, many people responded to these challenges in creative and innovative ways that provide lessons for us as Nebraskans about how to forge a way forwards. So we're really happy today to have a conversation about the impact of the pandemic, but also the innovations and learnings that have come out of the pandemic, with community members here working with us in Nebraska to share their experiences. So I'm really thrilled that our board treasurer and Douglas County Commissioner Chris Rodgers is here to moderate this session, along with Dr. Dave Miers from Bryan Health here in Lincoln, Ansley Fellers from the Nebraska Grocery Industry Association, and Jennifer Worthington from the Grand Island Public Schools. So they'll have a panel discussion for about a half hour, and then we'll have some more time for audience discussion and Q&A. So I'm going to hand it over to Chris now. Thank you.
All righty. Thank you. Good morning. Let me try to set some context for this. In addition to my role with the board and as a county commissioner, I also have the distinction of serving as the board president for the Douglas County Board of Health. So I have got a whole 2-year degree in infectious disease. But to set that stage, let's take the last 7 years. At least within the state, and I know within Douglas County, we've dealt with SARS, H1N1, swine flu, Ebola, COVID-19, and now monkeypox. So I think before the pandemic took total hold, I think people as a society kind of thought if an infectious disease happened, it would kind of stay contained over there. But it proved that there's no boundaries of water or anything that it can't go. So we come into effect now, and to put this in context, as things get hotter, infectious diseases become a little more potent. Let's take, for instance, in Douglas County, because of the heating of the atmosphere and lakes getting hot, we had a kid that went out to swim and they got an amoeba. And that amoeba caused that kid to die. And that is a direct result of the heating of the waters and an infectious diseases that happen. The thing is, it's going to keep happening, and we have to get ready for it. The military has an exercise that they do after every training, and that is a debrief. And we haven't really had a chance yet to really debrief the pandemic. Now, despite what you heard on 60 Minutes, we're not totally out the pandemic. We're in another phase, but it's not totally done. So today, our hope is to begin this debrief to get an idea of what happened in state, to kind of get an idea of how do we prepare for the future and what policies can help us get there. So to get right into it, I'm going to start with the first question to Dr. Miers and to Ansley, and that is, tell us what problems you were facing during the pandemic and how your work evolved out of trying to solve those problems.
Yes, thank you. So I'm from Bryan Medical Center Behavioral Health Services. I'm the director of behavioral health. And just to give you just a quick, what does that mean? We have the state's only mental health emergency department. So it's basically an emergency department within an emergency department. We have inpatient services, we have substance use services. So we have a full continuum of behavioral health services. We see between 6,000 and 7,000 individuals a year that come through our mental health emergency department prior to the pandemic, and have over 60 inpatient beds, 29 substance use beds, and then we have detox beds as well. during the pandemic, what we were faced with, obviously, is that we wanted to continue patient care, as well as keeping our staff safe. And one of the things that we were faced with on the mental health side of things, because we are acute care setting, so patients are only there a short amount of time, is to keep those beds and keep those units open, which we are able to do. On the substance use side, that's more long-term treatment. Individuals are there for 30 days or between 20 and 30 days. We had to go to half capacity because we had to go to single occupancy beds. And so what we learned through that process is how can we get those beds back open to double occupancy. And we learned a lot about how to test and so forth. And fairly quickly, we were able to get testing put into place so that we could test patients right away when they came into the emergency room and when they came into the substance use treatment center, whether or not they had COVID positive or negative, to whether or not we could admit them into the programming so that we could go back to double occupancy and get everything back open again to full capacity. The other piece was the workforce shortage. We saw a lot of individuals leaving the workforce, kind of halfway in, kind of a year into the pandemic, people leaving. And what we found is that it was hard to, and we continue to find this problem, trying to get people to come back into healthcare. And that's across the board with nursing, social work, therapists, psychologists. And prior to the pandemic, we could get folks to come right in and join the healthcare workforce. Even today, we're having a really tough time finding folks that are willing to come back into those positions. Telehealth was a big help to us at the beginning, and it continues to be a big help to us. The other piece that I just want to mention before I pass the mic is that the pandemic also exacerbated a couple issues that were going on during the pandemic. We already had patients in the hospital, senior patients, who would come in from nursing homes, who would be placed in our facility in either the behavioral health unit or in a medical unit, who needed services for medical services, but they also had a co-occurring mental health diagnosis. And once they were stabilized, we could not find a nursing home that would be willing to take them back. And I can talk more about that, later, but that has continued to this current day, where we have patients that stay with us for months and months, even past a year, where we can't find a placement for them. The other piece is the emergency protective custody law, where we have patients where the regional center beds are low in the state, and our crisis center is backed up, and the police department have nowhere to take patients that are in crisis. And then the last thing that I'm going to mention is then our youth. We're just seeing more and more patients seeking mental health care. And with the workforce shortage, we're having waiting lists upon waiting lists of people wanting to get into outpatient treatment. And we're seeing that not only in our facility, but across the community.
So I think there were a lot of similarities, and this happened to a lot of businesses and a lot of industries. So initially, the response and the role of the association was to disseminate information that was coming from state and local health authorities, federal health authorities, and getting it out to members. And their response was first to protect their employees and protect their communities and make adjustments, provided whatever the recommendations were at that time. And I think what happened in response to the pandemic was a faster development of online ordering, pickup, and grocery delivery. So I'm focused on the food industry in general. It definitely exposed some weaknesses in our supply chain. It did. I mean, we were resilient. Everyone came together. We figured it out. But the supply chain was a challenge, and it continues to be a challenge. And workforce, I think Dr. Miers mentioned about 6 months in, workforce became a very challenging issue for retail. It became a challenging issue in rural areas and urban areas alike. and it continues to be a huge challenge. And I think this discussion will take us to a place where I can expand on how online delivery and those sorts of services continue and how we're trying to broaden that. But that obviously takes an internet connection. It takes a certain amount of technical assistance for a retailer. And we also have to have the capacity to accept things like SNAP and WIC online when we do that. And right now, SNAP is available online, but again, retailers need technical assistance to get that up and running. And WIC is currently just a pilot program. So again, I think we're going to talk a little bit about innovative ways we're trying to broaden the scope of these systems, but it sped that up for retailers. And I think it's really important to consider, those, especially in small towns, but independent grocers in general, they were responding to their customers. They were responding to the pandemic. They did it really quickly. But there's still, if you think about elderly folks in the community who might not have an internet access, if you think about folks who have a difficult time with transportation, all of these things were challenges. And obviously just folks concerned about their own health and the health of those around them that didn't necessarily want to get out and shop. Those were challenges, and all those things we're still trying to meet.
So Jennifer, can you answer that same question? But before you get into it, can you tell everybody a little bit about the project you wanted, the Grand Island Community Schools?
Sure. I was asked to talk a little bit about full-scale community schools. That's a term that many people aren't yet familiar with. Full-scale community schools have been around for about 25 years. There are a few communities in Nebraska that have community schools, not very many. If you would Google it, there's a really simple phrase you'd probably see. The idea is that the school is a hub, and then the community comes into the school, brings services into the school. So that's valuable for a number of reasons. Our students and our families are already comfortable coming into their schools. In Grand Island, we have 70% of our families live in poverty, and transportation is a tremendous barrier. So somehow they figured out how to get to those schools. Maybe it's walking, maybe it's with a friend, maybe they share a car among spouses. So if we can bring services into the schools, we aren't sending them across town to 2 or 3 different places. And then the third advantage is it's very efficient. I ran 3 different nonprofit or service organizations in Grand Island, and we all had a mission. We wanted to provide services. Sometimes people in the community didn't know where we were or what those services are. So within our schools, we have a captive audience. Every community school is different. It's based on a needs assessment, and the services can be very different. And I think the way this ties into our pandemic conversation is those relationships are already built between the school personnel and the community organizations. So if there's a crisis, if there's a pandemic, it's easy to mobilize those services and get the ones that are needed. Every community school is different, but they all have 4 pillars they work on. They require integrated student services. So it's not just the school day and your academic learning. It's after school, before school, and summer activities. Expanded and enriched learning opportunities. And if you think of it in a high poverty school, some of us may have sent our kids to a science fair in the summer or a writing camp, or they may have been on competitive teams. Many of our families can't do that. So those enriched opportunities are within the schools. And then it's the collaborative leadership. It's not run just by the school. Those partners are part of it. So I was asked to talk about when it started in Grand Island. We opened our first community school at Lincoln Elementary in December of 2017. Last school year, thank you to a grant from Nebraska Department of Education and Nebraska Children and Families Foundation, we opened our second one at our O'Connor Learning Center, which is one of our pre-kindergarten buildings. And then based on a grant we just partnered with, and we'll hear about shortly, we're hoping to have 6 total in Grand Island Public Schools. So that is just one program we use to offer to meet student needs. As far as the question you asked about the pandemic, Grand Island faced the same thing schools across the country faced. I mean, we were on the news all the time. You saw lots of schools. Our students went home for spring break in March, and they didn't come back in person. They thought they were going to come back after a week. They didn't. I am so proud of Grand Island. We set up virtual learning within 2 weeks, and we continued feeding students within 1 week. You could pick up breakfast and lunch because our families depend on that. Our students sometimes dread weekends and holidays because they aren't going to eat well. So we knew we had to continue feeding those students. When we did return en masse, we saw things like isolation trauma. There was lost learning because it just wasn't as good as in person. We hadn't had a time at that point to plan for it. Behaviors escalated. A study that I'll mention in just a minute, 84% of staff members say they saw escalated mental health needs or behavior issues in students. And apathy and disengagement were very real. Even when we came back and we could open up some of those after school clubs and those sports, fewer students wanted to take part in them. They were used to being home on their own behind a computer. And then one of the biggest things we saw is we couldn't get substitute teachers because more staff were out sick. Some of our substitutes were retired teachers and maybe just didn't feel comfortable coming back into the work environment. And so mental health among our staff was a major issue. They were covering classes, they were losing their planned time. And that's one of the reasons, that mental health piece, is why the Nebraska Department of Education and CDC reached out to us and did a case study on Grand Island Public Schools. We added some mental health days for our staff where they had additional time off. We also added a few days where students weren't in school, but staff were, so that they could prepare, since they'd lost a lot of that planning time. So there is a study out there, if you're interested in it, that really talked about the mental health needs of our students and our staff.
So for all of you all, based on the solutions that you put in place during the pandemic, can you expound a little bit on which ones you think would be beneficial to take to scale and how that would benefit by taking them to scale?
Well, one of the things that we worked on right away, and we got this up, within the first 2 weeks, and I'm very proud of Bryan Health and how our IT department just jumped right in and with our electronic health record, where we were able to, with our outpatient work, offer the telehealth option to patients within the first couple of weeks. So, we did not shut down our outpatient services. So patients had the option, if they wanted to come in person and wear a mask and come in and see their therapist, they could do that. But they also had the option, pretty much, like I said, within the first 2 weeks to say if they wanted to come in or stay home and connect via telehealth. And we could offer that pretty quickly. We were offering telehealth prior to that, but only to outlying communities. So it took some work to make that happen. But a lot of folks are doing that. The other piece that I think that we were doing beforehand, but it really picked up during the pandemic, is that our mental health emergency room is something that we offered to outlying communities, to their emergency rooms, to connect via telemedicine, so that individuals, for instance, in Lexington, so that they wouldn't have to put that patient in a ambulance or in a police car and drive all the way to Lincoln to be assessed, and then if they weren't admitted, have to drive all the way back home, where they could just go into their hospital, connect via telehealth to our emergency room telehealth, and do that assessment. We give the disposition to that emergency room physician, and then they can make the decision there in their emergency room and either admit them somewhere closer to home or make that decision what they're going to do. So we have over a dozen hospitals now that connect with us, and we're trying to replicate that across the state to other hospitals.
So this spring, the legislature appropriated a small amount of money for food innovation. And right now, the Nebraska Grocery Industry Association is working with our friends at University Extension to identify at least one in this, initially, one grocer in a rural area that has an existing relationship with a large wholesaler. And that, to tie this back to kind of the online ordering and some of the transitions we saw, the goal is to use that store, that retailer, and that wholesaler relationship to get grant dollars on a ridiculously tight timeline. If anyone here is listening, a very tight timeline, to get those grant dollars out to allow that store in rural Nebraska. There's one in particular that just started. It's a cooperative style store, and to allow them to set up an online purchasing, an online store that accepts SNAP, and get them some dollars for a refrigerated truck, possibly staff if they need it, and lockers, refrigerated and frozen lockers in communities that either have a retailer that is too small to have a wholesaler, a kind of type A wholesaler relationship where they get direct delivery, or they don't have a grocer at all, or even a convenience store that's offering fresh food, to get lockers in those communities and then allow those folks in those kind of satellite communities to order online from that central store, have somebody load those orders in a truck and deliver them to a locker, so they can get fresh and frozen food in those places where they would otherwise have to travel out, or they're just not getting them. So that's kind of one very specific example of that kind of online ordering and the need to help, not just, I know we'll get into kind of what legislators can do, but obviously broadband access is a huge issue. And just getting dollars for some of those capital expenditures that small grocers don't have. And those, what we're trying to do is make it a win-win. There's a store, the one that just started in Emerson. Grocers operate on a 1% to 2% margin normally, sometimes even less. So any capacity we can give to that Emerson store, to get, a larger amount of orders, get a bigger quantity, drive down their costs, maybe increase their margin. It's a good thing for that store in Emerson that might otherwise struggle. And it's a good thing for those people in the satellite community. So that's one example of something that we're going to try to scale that was driven a little bit faster because of the pandemic.
A couple of things that I thought of in this area. The mental health services I talked about was the biggest thing we saw with both our students and our staff. And we struggled with this even before the pandemic. Grand Island is a city of about 50,000, an area of about 60,000. So fairly large when you think of Nebraska outside of Omaha and Lincoln. But we just don't have enough mental health providers. And especially during those after school hours where students and teachers could go to appointments. We did have some providers coming into our schools, again, with our community schools, so that families didn't have to travel, but it still wasn't enough. So we looked into a program called Hello Hero that has worked extremely well for us. It's telehealth, or basically it's online counseling. And to think about, even in one case, a preschool student, how do they meet with a counselor online? But it has worked so well. And sometimes they're more comfortable because they're in a more comfortable environment. They're not face to face with someone they might not know. There's that screen between them. And sometimes we're hearing they open up much better. It's expensive. Right now, we're using some of our COVID funding for that for the next few years, and then we'll need to find a way to continue it. But that Hello Hero has been something we've scaled and continued to do. We continued a virtual elementary school for 1 year after we went back face to face, and we continued a virtual secondary for 2 years afterwards. And we did have to drop it this year. There just weren't enough students to make it work, but would love to find a way to continue that. We have a number of alternative programs in Grand Island Public Schools, but for some students, there were isolation issues. It wasn't good for most students, but for some students, that virtual learning worked extremely well, either because of health issues, because of maybe social issues or mental issues. So that is something we continued for a bit, had to drop, would like to get it back. And then the other thing that was so eye-opening to many of us, and maybe we're behind and you all do this anyway, but we took cross-functional work teams to a level we've never done before in Grand Island Public Schools. Often you meet with departments where you have a similar focus, or you meet with people that are maybe at the same level in the organization as you are. And with the pandemic team, we had 21 people, from the supervisor of custodians to the administrative assistant who was tasked with trying to find masks and sanitizer and all that, to our coordinators, chiefs, and superintendent. And with the exception of the superintendent, which obviously sometimes had to put some guardrails in place, we were a team of equals. Decisions were made by every person in that team. You were never called out because, well, you decide because of your title. And so that's something we've continued to do. It was amazing how well that team worked and how some people thought of things that others of us never would have.
So for all of you all, workforce was a common thing. Any recommendations or solutions you recommend the policymakers out there to improve the workforce situation?
Well, I think with all of the workforce, but in the healthcare area, one of the things that we've thought about, and I know some of these things are being done, and especially on a national level, but with therapists and psychologists, one of the things that I know has been helpful with recruitment has been with their education and with tuition reimbursement. That's a big thing, but also with some of the licensure laws. So it's really difficult, when we're recruiting for therapists. Obviously a fully licensed therapist can do everything, but a provisionally licensed therapist is really limited on what they can do. Provisionally licensed therapists, most insurances will not cover a provisionally licensed therapist, and they're very limited on the types of patients they can see. And so we're only able to funnel certain patients to them, and they have to have the proper supervision, which is adequate, which we would continue. But I think looking at some of those things, and because they are trained and we do offer that supervision, but opening up the opportunities for them to see more patients. Also, I know that we have been looking at some different staffing models with looking at how bachelor's prepared individuals can come in and do some different things on some of the inpatient units. Whereas, before we were, very focused on, only hiring master's level folks, licensed folks, and trying to be more creative with some of our hiring.
Yeah. So I think representing the businesses I represent, they would appreciate if our elected officials took the Hippocratic oath and just first did no harm. That would be the number one request. And I think I would be remiss if I didn't mention that independent businesses, especially small and medium-sized one, and especially in rural areas, are going to get hit by an increase in the minimum wage much harder than companies like Dollar General and Walmart, who don't fund opposition to campaigns like this because they can weather it out and they wait for their competition to go out of business. So when I talk about a store in Emerson, an increase, not because these people aren't paying $15 an hour, but because an increase every year in the CPI and a commensurate or a constant increase in the minimum wage is going to be really painful. So I think independent stores and small and medium-sized businesses are really concerned about that coming down the pike. Again, not because they're not paying fair wage. It's even higher than a living wage. I don't necessarily like that term, but we really have to be thoughtful about some of those things we do. And I think obviously more, I say we're facing tremendous amounts of inflation. So while it would be nice to get more dollars out to do things like we talked about, the innovative approaches to getting food out to rural areas, I think the other thing that businesses would really appreciate, and again, kind of involving carrots instead of sticks, is incentives to provide leave. That's really hard for independent businesses, certain types of leave and credits or some amount of incentive and help to get childcare in these communities and help businesses help their employees put their kids into childcare. And I know that's a big problem in rural and urban alike. So we would definitely appreciate that.
Well, the first thing I'd have to say to the legislature is please fund the TIOSA formula. TIOSA is the state education funding formula. It's very important to school districts like Grand Island, like many of our larger districts where our local taxes don't provide enough for us to educate our students. So that state aid is very important. So I have to start by saying that. I also know that we are in a teacher shortage across the country. So I don't want to minimize that in any way. We're working on some things in Grand Island. But where we're really feeling hurt is our paraeducators. They are so important because they're in our classroom, we're working with our students. Sometimes our special education paras are working one-on-one with a student with high needs, and fast food restaurants are paying more. So we have made some changes. We've done the best we can to raise some of those wages, but that's a tough thing to keep our paraeducators. One thing we've worked on, and if there was additional funding, we'd love it, although we put some funding into it, is a paraeducator to teacher path line. We do have paraeducators that for whatever reason, when they were 18 years old, they couldn't go to college or chose another path. And now principals see them as very effective with students and say, hey, you should be a teacher. So we've tried to put some programs in place to help them on that path.
All right. Last question to the panel before we open it up. Any recommendations you feel that you didn't get a chance to stress that you feel policymakers should know to help us through in the future?
Yeah, I had one more comment on I'm glad you asked that, because I had one more thing on to mention about in terms of policymakers. The one thing that so Bryan Health is a nonprofit entity, and we don't receive state and federal funds through Region 5, but we work a lot with our colleagues here in town that do. And over the almost 26 years that I've been at Bryan Health, I have unfortunately seen a lot of those services across the state have to close their doors because they could not keep those staff. They could not keep therapists and nurses and folks because they couldn't pay those folks. So I know a lot of these things always come down to funding, but definitely in behavioral health, it really does. A lot of folks in some of these in the behavioral health industry and in these agencies are really having a hard time recruiting. There's a shortage for behavioral health providers, but many of them are having a hard time recruiting them because they can't pay the wages that some of the other agencies are able to pay, the for-profit agencies. And then some of these therapists, once they get out of school, are going into private practice, even if they are provisionally licensed, because they can probably make just as much or make enough to keep going until they are fully licensed, and they just don't want to go into an agency. And so it would be helpful if those agencies could receive increase in state funding that would help them be more competitive with some of those other agencies.
Yeah, I think the best thing the state can do for workforce and from our perspective is just helping us. I mean, obviously attracting more people here, making it great to be in Nebraska, but also helping us connect people to these job openings. And we are obviously wholesale retail is very beneficial to folks who are either first time, coming into the workforce for the first time, who might be rejoining the workforce. And also we're working on, we have a turnkey program with the National Retail Federation that allows for credentialing. And I know credentialing isn't beloved everywhere, but it would allow employers to see that folks have taken some classes, whether that's in retail or in wholesale, making sure that kids know that they're, trucking, driving, all of those are really, really good paying jobs, and they're really, really needed. And even folks that are transitioning out of corrections connecting those people to these types of jobs would be really beneficial. And that's something that we're going to keep working on, and just helping. The Nebraska grocery industry always supports an increase whenever the state takes it upon itself to expand eligibility for SNAP. And on the surface, I think people think, well, of course you do, because people are going to go spend it in your stores, which is great. But also it allows our employers to give people raises, to give them more money and allow them to keep their SNAP benefits. And that is a huge factor. I think anything the state can do, I know it's the federal government needs to act too, but anything the state can do to ease the cliff effect when it comes to helping families, anything we can do to make this a win-win for businesses and consumers is a great thing. So yeah, thank you.
I reached out to some of my friends who help with full-scale community schools and before and after school programming at NCF, or Nebraska Children and Families Foundation, the Department of Education, and they sent me 2 pages of ideas. But the one common one was additional funding for before and after school programs, including full-scale community schools. It does maximize resources because you've got many organizations working together. And although all students participate, all families can participate, it helps those that have the least, who would not be able to get those kind of experiential and expanded opportunities if it weren't for the after school and before school programming.
Any questions from the audience?
Thank you.
So two questions, and I don't know if there's anybody from community colleges here, but we did appropriate, I think, 5 million for 3 years in a row for dual credit with the idea that you would get high school students into community college to answer some of the workforces. And I know that Metro Community College just announced, I think in the last week, that they're going to do tuition free for any high school student. So are the other community colleges following suit?
I can only speak for Grand Island. We do have tuition free for our students. It's through Wayne State College. We do work quite a bit with our community college. It's not completely tuition free at this point, but we have students who leave high school at the sophomore level. The fact that and don't write this down, I think it was 2 years ago, or maybe this is the second year where we were able to do it tuition free.
So that would have been before we this appropriation was just done this spring to all the community colleges.
And like
Or
I
dual
said,
credit.
our community college, unless it's changed, I don't work with them, and it is not tuition free. It's through a different college that we have tuition free. So yes, it would be outside of the appropriations that you all did.
And then I think we also provided a 15% increase in provider rates for behavioral health. But I did hear there was it didn't treat Douglas and Lancaster the same. Can you address that?
Yes, thank you for that. That was a historic increase for our providers, and that was very much needed in behavioral health. So yes, we did get a 15% increase in Medicaid rates that went into effect in July, but I'm not aware of the Lancaster, Omaha situation. No.
Well, Senator, can you define what you mean, not treat us the same?
And this is, you're elected official, you hear things, you're in the grocery store, somebody says, it's great, but this happened. So somehow Douglas County didn't get the 15% or different providers. Maybe you've not ran into this yet. It's coming.
No, we had a meeting Monday and we've got it. Now I'll be sure to ask based on your question if there's some distinction somewhere else, but it's hit, we felt it. We felt the first payment.
This is a question about telehealth. I read recently in the Lincoln paper that a major insurance company, Blue Cross, is planning to discontinue coverage for telehealth appointments. Does that is a legislative solution appropriate here, or will competitive pressures from other insurers take care of that problem? Are there any implications for health providers?
Yes, I think that would be helpful because my belief is that once the large insurance companies start moving that way, then the others will follow suit, and we're going to take a step backwards. So I mentioned that we were able to jump in fairly quickly to make changes with telehealth. That was countrywide. I think folks said that we did 10 years worth of telehealth work in 2 weeks nationwide, and we're reaching and providing care that we were not able to provide before, not only in behavioral health, but just in the whole industry. And I believe that we're saving money in that way and helping folks. And if we stop providing that or stop providing that funding, we're going to take a step backwards. Yeah.
That's a big deal for employers too. We've heard from a lot of employers who are very grateful that they can offer their employees something sensible as it relates to telehealth, and that people can have their kids on a telehealth appointment and get an antibiotic prescription without having to pick them up load them in the car and drive them 30 minutes and take an entire day off of work. They can actually, get a visit. And maybe that's a bad example, but I've got employers that rely a lot on that, especially in rural areas.
I have 2 questions. The first one is quick. and it just refers to mental health services for children and youth. Okay, that's the domain. So you mentioned you had 6,000 to 7,000 visitations a year before COVID. Okay, this is it, Bryan. And so I'm wondering if you quickly could say what the number is for during COVID and after COVID. But then the more 50,000 foot question is that we frequently hear, and again, we're talking about youth right now, that we do not have sufficient mental health services in communities to help schools to meet the mental health needs of the students, let alone enough school counselors and so forth. So I would just like your opinion. How short are we? Or what would it take to have at least an adequate or best of all possible worlds approach to mental health services in Nebraska for support to our schools?
To answer the first question, last year, I don't have the exact number, but I'm always one to like, we all set goals, but we want to break goals or set records. And this is a record that I don't think we want to try to break, but we broke a record last year by seeing the most people through our mental health emergency department. And so it was, I think it was over 6,500. I can't remember the exact amount, but that's adding the in-person visits and the telehealth visits together. So in the 26 years that I've been there, that was the most that we've seen. And we're attributing that to the pandemic, that there's more people seeking help and reaching out. And so then you want to, so the next question is, what would it take to have an adequate supply to cover the state as far as helping youth? Good question, yeah.
Can I take a shot at that?
Yeah, go ahead.
Okay. But this is add a little bit. So I want to talk to you a little bit about, I think, what the ripple effect is. I mean, you just talked about providing services, but let's say on the other systems. So let's take the youth court system, juvenile court system. That demand, I think, is so high that they don't have enough people to serve. And without having enough people to serve juveniles from a mental health basis, that is causing the time that this kid has to sit in a facility that's causing them to stay longer, because it takes longer to get them through the process. On the other end, there may be kids in the facility that we have, but the lack of mental health providers outside in the community is not allowing us to move those kids through the system fast enough, because that workforce is not there. So I don't know what that number is, but every time I hear it from every place, it is substantial. Substantial. And that's relevant to what community you're in.
So, and it may be that our treatment approaches may need to change in the future, because when we hire somebody into let's say our outpatient clinic, we're always hey, we hired somebody. This is really exciting. They're going to help us fill that gap, but within a month they're full, and we can't get anybody into their caseload, and we're back to square one, and that we need to fill another person, and then we run out of space, and it's like now we're out of room, so then it becomes a space issue. So it may become a situation where we need to get folks in quicker and move them into a different model of treatment.
One point to add on that, because before we go, is that I would say I was in a room 5 years ago with some superintendents in Douglas County. And the glaring thing that they talked about then at that point, all of them on a common ground, was not so much the education requirements, it was the mental health issues creeping in. I was in a room with a few of them 2 weeks ago, and that has probably increased substantially because of COVID and the things that are coming back in. So to your bigger point, it's the demand is so because it is spreading outside of the traditional realms. It is on public health's radar now because of what social media is doing in these interplays and causing that to eke out into issues with behavioral health throughout certain populations. So it's a lot of interplays out there in some respect. And that's why I state particularly that the need is substantial, because it's making situations rise up that you didn't have before.
Well, with that, I'd like to thank our moderator and all of our panelists here. Thank you so much. Clearly, we've seen there's some real needs that have really focused around mental health services and around workforce development, but I think we've also seen some proactive ideas and opportunities to follow up on. So thank you so much. We're going to take a break now, and we'll be back at 11 o'clock for our keynote speech. So we'll see you back.